Good morning friend, welcome on my channel Charming Science. Today we are going to talk about the bone capitate. So the capitate is one of the eighth carpal or wrist bone in the human hand. It is classified as the short bone and is the largest of all the carpal bone. The capitate is central and the largest carpal bone. It is the third bone from the thumb side in the distal carpal row. It's having a wedge shaped between the trapezoid on the radial side and the hamate which is present onto the ulnar side of the hand. The capitate is located right at the center of the human wrist. So when we talk about the anatomy of the capitate bones are having an oval shaped structure. It's having an oval shaped structure with having a diverse function and anatomical feature from other carpal bones. The upper part of the capitate, which is lies toward the metacarpal side, is known as the head, while the lower part, which lies toward the proximal row of the carpal bone, is known as the body, and the middle part, which is lies between the head and the body, is referred to as the neck. Due to having the shape, it's come from the Latin word which means caput, meaning head. When we talk about the articular surfaces, then the head, it is having a convex surface and articulate with the scaphoid and the lunate bone. It's having a neck, a constricted portion connecting the head to the body, and the body, it is slightly flattened, bears facet for articulation with the metacarpal and the other carpal bone. So when we talk about the articulation of the capitate bone, we will find that a capitate have a complex interplay with the 7 neighboring bones with having a different movements. So when we talk about the proximal surfaces, it is a smooth convex surface for articulation. So the proximal surfaces give having a smooth and convex surface. So here is the convex surface that is present here and it provide attachment to the scaphoid and lunate. So scaphoid provide a stable base for the capitate and facilitate wrist flexion and extension, while the lunate act as a key link between the radius and the carpal bones, influencing wrist rotation and the radial deviation. When we see the capitate bone distally, we find that there is having a 3 facets and their facets articulate with the trapezoid bone. One of the large facet articulate with the third metacarpal, is having the large facet which articulate with the third metacarpal. There is having an inconsistent facet which articulate with the fourth metacarpal. There is having a small facet that is articulate with the fourth metacarpal, and they form the foundation of the finger, allowing for flexion and extension and abduction from the metacarpal joints. When we talk about the radially, we see that they are having a facet for the trapezoid bone which contribute to the thumb movement and the grip strength. There is having a facet for the trapezoid bone. When we see its ulnar side, we see the hamate articulation with the hamate. We see a little concave surfaces which provide the articulation for the hamate bone, and there is a non-articular surfaces which is present at the dorsal and the palmar side. The dorsal side provide attachment to the ligaments and provide stability to the wrist joint, while the palmar have the groove from which the flexor carpi radialis tendon and the crucial for wrist flexions. When we talk about the attachments and the ligaments that occur on the capitate bone, so the first is the radioscaphocapitate bone, second is the ulnocapitate, scaphocapitate, capitotrapezoid, capitohamet, triquetrocapitate ligament, and the trapezocapitate ligament. So the first one indicates the bone, and the second one also indicates the bone from which is the ligament is starting and from which to which the ligament's attachment will end. So first of all, the radioscaphocapitate ligament, we will see that it starts from the toward the radius side and go toward the scaphoid and then capitate. It's provide attachment like this: radioscaphoid ligaments. Second is the ulnocapitate ligament. So the ulnocapitate ligament provide the attachment from the ulna to the capitate. The third one is the scaphocapitate ligament. It provide attachment to the scaphoid from the capitate bone. The capitotrapezoid, it provide attachment to the capitate to trapezoid. The capitate hamet, it provide attachment from capitate to hamet, not from hamet to capitate. It provide attachment from capitate bone to hamet. The triquetrocapitate ligament, the triquetrum from it start from the triquetrum and provide attachment to the capitate, and then the trapezocapitoid. The another one is the trapezocapitoid ligament, which provides the attachment for the trapezoid to the capitate ligaments. When we talk about the blood supply, it gets its primary blood supply from the dorsal basal, metacarpal, and dorsal intercarpal arches. Additionally, there is having some anastomosis. There are the other some capillaries or the some small branches which supply the blood supply to the capitate of the palmar intercarpal, and the ulnar recurrent arches provide minor vasculature to the capitate bone. When we talk about the function of the capitate emerges as a versatile performer in the hands, taking center stage, so it's help in the power gripping, precise grip, and the movement which occur in the opposite direction. Its strategically placement within the carpal arch position it to efficiently distribute forces during a spectrum of hand activities, whether engaging in tasks demanding strength or finishes. The capitate notched contribution to the coordinate movement become evident. Since it is located at the center of the wrist, the axis of rotation for any wrist motion will pass through the capitate. When we talk about the ossification of capitate, the capitate development begin with the single ossification center. It's having only one ossification center, and it's start appearing at the 3rd and to 8th months of fetal life. The solitary center undergoes progressive ossification, usually reaching completion around 10 to 12 years of age, making it one of the last carpal bones that mature fully. There are some clinical conditions which are associated with the capitate bone. One of all, first of all, is the fracture. The most frequent type of carpal bone fracture can result from fall, direct blow, or having some sport activities. It may require sometimes a surgical intervention or sometimes the extensive rehabilitation. There is one common condition is cane box disease. It's known as the avascular necrosis of the capitate due to interrupted blood supply. That we have talked that it's having a major supply from the anastomosis or the smaller capillaries. So if the capillaries get necrosed or having some obstruction in their flow, then the avascular necrosis can occur, and the avascular necrosis lead to the cane box disease, and it lead to debilitating wrist pain, stiffness, and functional limitations of the capitate bone or the wrist. That's all for the capitate bone. If you like it, please like, subscribe and share our channel. Thank you.